Getting pregnant should be very easy, but recently a lot of people are finding it very difficult to conceive. And because of that, they are looking for easy ways to get pregnant. And in this video, I'll be telling you some things that you can do to improve your chance to get pregnant this month. Hello, everybody. I am your Wongo Nation president here, and I am going to be telling you things that you can do to improve your chance to get pregnant. When two adult couples have been in the same space for a whole year and they are trying for a baby and pregnancy has not happened, it is called infertility. Infertility is becoming very, very common these days within young people. And the reasons for this is staring right before our faces. Things like people starting off fertility journey very late. You'll see people in their late 20s, early 30s, and that is when they want to start off their fertility. There is no problem to that, because if you want to follow a particular pathway in life, that is what you want to do with yourself, and that is absolutely fine. But the thing is, as you are waiting, the quality of your egg is reducing. Age also affects men, so this is not just for women alone. Other things like cosmetics, household cleaning agents, stress. These are things that has made infertility to be very common amongst us. But there are things that you can do in your own little way to improve your chance to get pregnant naturally. In your trying to conceive journey, you're going to hear a lot of things, and most of those things that you hear are not correct. Some of the things people will tell you to do in your trying to conceive journey to improve your chance is things like, when you meet with your partner, do not rise up immediately, the swimmer will fall outside, you will not get pregnant. That is not true. It is a myth. The sperm has a way of finding its very intended location, which is the egg. And it is not every sperm that is deposited inside of you that needs to locate the egg. So during an intercourse, about 200 to 500 million sperms are deposited, and out of all these numbers, only one of them will fertilize your egg, and then pregnancy will occur. So you see, you don't really need every sperm to be inside of you for you to get pregnant. You only need the ones that are quality. Number two, people will tell you not to drink water after you meet your partner because it is going to flush out everything. This is also another myth, and it is not correct. You can drink water. Water will make you to relax a little better. We'll even tell you not to urinate. Urinating is good because it will help you to flush your urethra, that is your urinary system, and keep it away from urinary tract infection. So all those things are not things that you should be worried about when you are trying to conceive. Now I'm going to go ahead to tell you things that you can do to get pregnant naturally as somebody who is trying for a baby. Number one, you need to know your cycle length. A lot of ladies don't know their cycle length, and your cycle is one of those things that tells you a lot about your reproductive health. Cycle length is calculated from the first day of your last period to the day before the next one starts. So if you know when you got your period in April, you want to start counting from that date to the day before you got it in May, and that will give you one cycle length. There are a lot of cycle apps that can help you keep an eye on your cycle length, and they are really handy. It can help you to remember your dates, help you to speak to your doctor a lot more accurately when they ask you questions about how regular your cycle is or how irregular it is. Remember that your cycle being regular or irregular is a lot of information to your doctor when you are trying for a baby. Number two thing that you should know is the ovulation time. While this might not be very important for people who live together, if you're in a relationship that is distant, both of you don't always have time to meet each other, then knowing your ovulation day can help you. And how it helps you is that you can be able to do what is called timed intercourse with your partner, where you meet majorly during the ovulation time. How do you calculate your ovulation? If you know your cycle length, subtract 14 from it. Now, the answer you get, you will count those number of days from the day your period started. If you don't know the meaning of ovulation, it is simply the release of matured follicle from your ovary. It usually happens 2 weeks before your next period. So if your period starts today, that means you probably ovulated 2 weeks ago or 14 days ago. Time between your ovulation and the next period is usually 14 days. That ovulation day is really important. Number three, you need to know your fertile window. You can calculate this from your ovulation day. So if you know your ovulation day, count 5 days before that day and 2 days after. This is the time you have the greatest chance to get pregnant. Another thing you can do is to monitor your biomarkers to know when you are most fertile. Your biomarkers are those signs and symptoms that will happen to you during your fertile window. One of them is tenderness of your breast. So during the middle of your cycle, you start noticing tenderness around your breast area. It can be telling you that you're fertile. It could be the time you need to try. Number two, if you're noticing fertile cervical mucus consistency. Your cervical mucus is very important in your trying to conceive journey because it protects the sperm when it goes inside of you, and it helps the sperm to actually swim into your fallopian tubes. So if your cervical mucus consistency has changed to slippery, then that is also the best time for you to try. Other things like increase in body temperature, having urge to have sexual relationship with your partner are other fertile window signs that you can have as a trying to conceive woman. And when you try at those times, you have a very great chance to get pregnant. Remember, some people can get pregnant the first time they try, while for some people it can take more than one trial for them to get pregnant. Remember, for an adult couple who are normal, a man and a woman, certified medically okay, your chance to get pregnant every cycle is 25%, and this is when you are less than 35 years of age, above which the chances are no longer 25%, it starts to reduce drastically. So if you don't get pregnant the first month of trying, try again the next month. If you are above 35 and you've tried for 6 months, go and see a doctor if you don't get a positive test. And if you're less than 35 and you've tried for up to a year and there is no positive result, then you need to go and see a doctor. There are exemptions to these rules. If you know that there is a particular health condition you have been diagnosed with before you started to try for your baby, things like polycystic ovarian syndrome, endometriosis, adenomyosis, ovarian cyst, low sperm count, heart conditions, high blood pressure, diabetes, and you're finding it difficult to get pregnant now, you shouldn't wait. You should go and see your doctor and take care of those health conditions, because sometimes some of the medications you might be on might be hindering you, or the health condition itself might be causing you not to get pregnant. People who are trying to conceive can also benefit from eating quality diets, exercising, reducing stress, and also taking certain supplements. Every trying to conceive woman should be on folic acid. That is routine. And the reason for that is it helps with the proper development of your baby's brain and spinal cord. Other supplements should be on your personal need and depending on whether you have a health condition that allows you to take such a supplement or not. If you've watched this video to this point, it means you love what I do here. I would like you to subscribe to my channel and also make sure you share this video to your friend who is trying for a baby. I hope this video helps all of you. I am still your Wongo Nation President, and I will see you all in my next video.